Hey, it's Dr. Bob at New Life Counseling Center, and this video is to introduce you to counseling. I'm going to go very quickly. First, there's two different categories of licensure for counselors, okay? The one that everybody's familiar with are the ones that are licensed by the state and work with insurance. By definition, the education that these folks receive is secular. It follows a medical model where there are symptoms and diagnosis, and then a treatment plan that follows the evidence-based protocols, right? Not a problem with that, okay? Just understand that it is secular and methodical and effective in many cases, okay? The other is faith-based. And faith-based folks, like me, do not follow the insurance protocol, the diagnosis and medical model, right? Which is sometimes adversarial and controlling. So just briefly, my education, I went to Bible college and seminary, got a master's in biblical counseling, the application of the scriptures to counseling, right? So with that foundation, then I got a PhD in psychology. So I sort of understand both worlds, right? So with that, now you understand why faith-based counselors work on a sliding scale and don't cooperate with insurance. Now, among all counselors, there are 4 different approaches, okay? Ministers like me, we approach it from a spiritual standpoint. And if you go to someone who is, let's say, a pastor, okay, they're trained in the spiritual realm, and that's very, very important. But when you're a hammer, everything looks like a nail. If spiritual is all you have, well, spiritual isn't always the answer, quite frankly. The second one is you would go to a caring, compassionate counselor who listens and cries with you and is emotionally supportive. And oh my goodness, how wonderful when that's needed, okay? The third is you go to a psychologist, and psychologists are trained in cognitive behavioral therapy to pay attention to your mind, your mindset, your belief system, and to work with modifying that. Sometimes that's exactly what's needed. The fourth and final is your physiology. So you go to a medical doctor, like an MD or a psychiatrist, and they work with brain chemistry, and they're going to give you a pill. They aren't necessarily going to pray with you. They're probably not going to be the caring, empathetic listener, right? And pretty much it's a pill. So you have these 4 different things, all of which are tremendously beneficial. Okay, I am trained in 3 of the 4, okay, with a focus on physiology, health, wellness, and nutrition, psychology, the mind, right, the spiritual part, ordained minister, and then the emotional, right? As a guy, I'll freely admit that the emotional is my weak suit. But here's the idea. You have a chair you're sitting on that has 4 legs. The question is, which is the short leg? What does my client need at this moment? Do they need to vent and receive a good listening ear? If that's what they need, that's what they get, right? Maybe they need to have their thought process challenged. Maybe they need to get up and exercise in the morning instead of sitting around eating bonbons till 4 in the morning. Right? And maybe they need, well, you decide, right? But the point is, one of my heroes is Bruce Lee, who famously was in an interview said, "Be water, my friend." And the idea is conform to what the need is. As you look for help in your situation, recognize that you have 4 different legitimate needs. And my best advice to you is go to someone who understands not just what you think you need, but understands as many of the legitimate needs as possible. And I humbly submit my candidacy for you. Thanks for watching.